Now we're further down into the digestive tract, so let's review some of those ideas and apply them to this lower digestive function treating disorders like ulcerative colitis. So earlier we talked about mucilages like marshmallow and slippery elm. Same situation, works very, very well further in the gut. Let me add another, mullein leaf. Mullein leaf is a cooling green leaf, anti-inflammatory, full of slimy mucilage that makes a very good digestive mucilage. It's not as much of a heavy hitter as slippery elm or marshmallow, but it's one more remedy with a more profound anti-inflammatory effect. You could add that to your bag of tricks. It's likely to work well. Mullein leaf can be consumed as powder. You can take it as a tea. The tea is a little slimy. That slime is what we want. Capsules would be fine. Bulk laxatives, including soluble fiber, slow this intestinal motility. So remember that the main characteristic of these inflammatory bowel disorders is unpredictable, sudden emergency diarrhea, maybe several times a day. So soluble fiber bulk laxatives tend to absorb that moisture, soothe the gut, and stabilize that diarrhea situation. So some of the ones you might consider are fruit pectin, very well known soluble fiber, flaxseed, chia seed, oat bran. All of these contain soluble fibers that we know are used as laxatives, but in fact can treat diarrhea through that mechanism. So you experiment with the one that works well, try a few, find some combination that is a good choice for the particular client. Often we can use these in combination with things like astringents and anti-inflammatories and come up with a program that will completely control symptoms for people as we get at the underlying heart of why their body is creating this inflammation. One important thing to remember about fiber laxatives is that they absorb a lot of water, many, many times their own weight in water. So it's critically important to take them with enough liquid or they'll absorb all of the water in the gut and form a blockage, which will be very uncomfortable to people, and they will actually prevent bowel movements. So plenty of water along with them. Start with a very small amount. I usually start with a 1/4 teaspoon of any of these soluble fiber powders taken with a glass of water, and then increase that in incremental doses, divided doses throughout the day with the water to reduce that problem of binding up from it absorbing the intestinal water. The next area we can consider for inflammatory bowel disorders is overt anti-inflammatories that get more to the underlying root of the problem. First one to mention is turmeric that we discussed earlier, an astringent anti-inflammatory, a wonderful remedy, one of my top suggestions for inflammatory disorders of the gut in general, especially for colitis. Another remedy that's worth knowing is Baikal skullcap root, a Chinese herb that has profound anti-inflammatory properties, different active constituents than turmeric. The constituents in Baikal skullcap are other polyphenols, but powerfully anti-inflammatory. Typical Baikal skullcap dose would be about 10 grams a day. That could be taken in capsules or brewed into tea, and likely to work very well. So a number of these anti-inflammatories get at the same underlying issue. We don't have to use all of them, but we can experiment with the one that produces the best results in the person that we're dealing with. Gentian root, another very famous drastically cooling herb from Europe, also used in Ayurveda and Chinese medicine, a substantially cooling remedy, one of the most bitter remedies in all of Eurasian herbalism. Doses can be relatively small. Even a few grams of gentian can be quite anti-inflammatory for the gut, so we can add that to our program of soluble fiber, astringents, and such. And then licorice root, in addition to being demulcent, as we discussed earlier, also has this profound anti-inflammatory effect. Remember, if you choose to use licorice in the DGL form that has the glycerizic acid removed, you'll get the demulcent effect. Chewable wafers are great for that, but you won't get the systematic anti-inflammatory effect. So you want to consume whole licorice to get that anti-inflammatory effect, not deglycerizated licorice. Our next category is astringent herbs. We mentioned that turmeric has some astringent benefit, but let's talk about some that reduce inflammation and diarrhea. Astringent herbs help to seal up the gut, basically, so that the digestive tract isn't dumping water into the gut. They help to astringe or contract ulcerated areas of the body, reducing bleeding and reducing damage from those ulcerations, a great addition to your program. Oak bark is one of the most potent astringents used in Western herbalism. It works very well to astringe the gut in these kinds of cases. It's a powerful herb, tough to swallow because of the astringency, so maybe capsules would be the way to go here. Oak bark tea is unlikely to work very well. It's just going to not be drinkable. The other problem with these astringents, especially powerful ones like oak bark, is that they tend to astringe the entire tissue as they're going into the digestive tract. So they may create a little discomfort further up in the gut. So capsules or mixing them with other mushy foods so they make it further down the gut before they have their astringency is a good bet. So relatively small doses of potent oak bark, a great astringent to treat ulceration in the gut. Agrimony, another very famous, well-known Western herb, is a less potent astringent than oak bark, but likely to work well, and it's a little better tolerated by people, so we could use doses that people find comfortable to use. The dose might have to be a little higher than the oak bark. You might talk about several grams of agrimony per day. Golden seal, a classic astringent for the digestive tract, and again, that has the advantage of being antimicrobial and drastically cooling. So we've mentioned a number of them, from turmeric through the potent oak bark and all the way through golden seal. Experiment with the ones that you find to be effective, and if they enhance the treatment protocol, then work your way into them gradually according to the person's tolerance. They'll also hold back the diarrhea, which is going to be a benefit.